Welcome back to the EAU Podcast series, Effective Performance and Personal Success. In this episode, we are joined by Juan Luis Vásquez, a consultant urologist at Zeeland University Hospital. Juan is also Associate Professor at University of Copenhagen, Denmark, and the chair of the EAU Young Urologist Office. Also Jason Howlett, a coach specializing in behavior change, mental resilience, and well-being. He helps individuals and organizations optimize their performance by aligning energy, focus, and habits for sustainable success. Together, they explore the key principles of energy management, discuss strategies for optimizing physical and mental energy, balancing rest and activity, and sustaining high performance. Join us as we embark on this informative journey.
Hello, Jason. Welcome back to the EAU Podcast. I'm very happy to have you here. And today we are going to talk about how to maintain our energy levels at the top. Welcome, Jason. Nice to have you back.
Thanks, Juan. How are you doing?
I'm great. I'm really looking forward to our conversation on energy levels because this is something that actually I personally have struggled with because with all these huge workloads, I'm really lacking of energy. So, and I'm sure that this is not something that applies to me only, but for most young urologists having families and kids and a lot of dealing with their clinical work and research. So, yeah, there's a lot out there.
Indeed, and I can hear from the involvement I've had so far on the Talent Incubator program that we have the next module for in April. In Valencia, in the previous year, definitely a lot of questions coming up around these topics that you mentioned. And I think it's a challenging sort of time to be in terms of managing stress because we've got, as you mentioned, all the workload. But on top of that, we are very easily, suffering from all of the sort of things that are grasping our attention in terms of the technology we use. Plus, we're living in pretty uncertain times with everything that's going on politically and sort of globally with the climate situation. So to keep it kind of straightforward, we can look at kind of energy stroke stress management from certain aspects. And, we've got a kind of foundational element of sleep, how we can get enough quality sleep when it matters most. And then on top of that, we have daytime recovery. We've got exercise and our level of fitness. And then lastly, we have nutrition. So these are kind of the physiological aspects that we're going to, cover and look at. But of course, other areas of our life impact our physical energy, our relationships. They are, if you like, one of the most important sort of psychological stroke, social elements for how much energy we have. So where should we start?
I guess we should start with the sleep. How do we get a better sleep? And I remember one of the easiest ways to have a better sleep, you told us that when you were doing the workshop in my department, is get a new bed, get a good bed. Can you beat that?
Yeah, so we need to have a good starting point on actually having a comfortable environment to sleep in, and of course, our bed is one of the best investments we can make because we want to ensure we have a comfortable mattress and pillow, and we all know when we travel often that not being in our own bed can be one of the first things that can interrupt our quality of sleep. So in addition to actually having a comfortable bed, the other sort of simple things we can consider is first of all when we go to bed, right? So studies show that the majority of the population need around 7 to 9 hours of sleep a night, right, as an adult, unless we have a condition that means we need more or less. So 7 to 9 hours. Me personally, I actually find if I get towards 9 hours, I feel even more tired. So around 7.5 is optimal. But then it's thinking, okay, so then when is bedtime? And we all have like what's called the circadian rhythm, the day-night cycle, where it's influenced by melatonin and cortisol. So melatonin helping us to sleep, that kind of tends to peak from 9 to 11 p.m. And cortisol, that's naturally activating us, right, and waking us up, which could be anywhere. It starts to rise from around 3 to 4 a.m., but will peak at around 9 a.m. So these things kind of help govern sleep, the melatonin and cortisol, but we also have what's called sleep drive or sleep pressure, which is managed by the adenosine buildup. So this adenosine is something that will naturally build up throughout the day. And as our body's detecting rising levels of adenosine, we get sleep. So ideally, to keep this simple, we want to be setting a sleep sort of time where we want to sleep being realistic. So getting that closer to 11 p.m. for many is better than, for example, 1 a.m., right? So first of all, it's kind of setting a plan of how can I get to a time that gives me at least these 7 hours of sleep based on when I need to wake up. And then work back at least half an hour to an hour before that bedtime. Let's say it's 11 p.m. So think, what am I going to do for the last half an hour to an hour before that? So we call this the wind down routine. And it is honestly one of the most impactful interventions to consider. And you might spend that time simply reading a book, quality time with your partner, meditating, breathing exercise, whatever you find is relaxing. And during that time, you want to be in a comfortable environment, dim the lights. You want to really be sort of helping the body to kind of unwind. But simply reading a book, a fictional book, has been one of the easiest kind of wind down routines people have found to help them get more better quality sleep.
So it's literature and not scientific literature we're talking about.
Some people might find that's okay, but the good test is, does it help you to feel more sort of sleepy and tired? And do you find when you wake up in the morning that you feel that you've had, less episodes waking up and you just feel more refreshed? And maybe that could be scientific literature, but for many of the people I've worked with, they've found that kind of gets their head, if you like, their brain more activated and gives them more thoughts about, okay, what's the then outcomes of that, or how can I use that in my research, etc. So a fictional book, a story that you can get lost in, is often more relaxing.
So what about sex? Is it good to have a sex before you go to sleep, or is it too energizing, or is it what how is it?
Yeah, for most, at least from the experience I've had some clients, it's a good question. For men, it can be a very good thing. We tend to feel pretty relaxed afterwards and ready for sleep. For women, it can be the opposite. But again, it depends on what sort of orgasm the woman is having. So if it's a clitoral orgasm, then quite often they're even more stimulated and activated. But it depends on the length of sex as well, right? If the woman is feeling too activated after sex, she can always take more time on top and be more physical and get more physically exhausted. So I think keeping it simple, sex is good before bed and will promote better quality sleep.
Awesome. So literature, sexual intercourse can help. Social media, that's something that people usually go to before they go to bed.
Yeah.
Is it a good thing?
Yeah, it's one of the worst things. Social media, the news, and of course work, you really want to try and avoid that for the last half an hour to an hour before bed. Because, even though social media might feel good, you want to keep watching the, TikTok video after TikTok video or Instagram photos. What social media does is essentially trigger a lot of thoughts, which we might be conscious of, but often we're not conscious of them. So, am I liked? You're comparing yourself against others. So it's really triggering thoughts around your self-esteem, self-worth. And often that really activates us. It might be things we see that concerns us, right? That's just reiterating feelings of not being safe, feelings of worrying about what's happening. So yeah, it's really recommended to avoid social media and the news and of course work for the last sort of half an hour to an hour before you want to sleep.
How do you measure that? Because I sometimes personally feel like, okay, I have to work and I do the work because you have time after, let's say, after dinner, and then you have to spend a little time with your family, with the kids, and then they put the kids to bed, and then that's when you finally have time to work again, and then you have to go to sleep. But I don't personally feel like I have difficulties into falling asleep.
Yep.
But that doesn't mean that it does not affect my quality, the sleep quality, right?
Yes.
So is there a way to measure that?
Yeah, interestingly, I've been using wearables to measure people's sleep for about 15 years. And what we can see from this wearable data that measures heart rate and heart rate variability. So I've done this both with ECG or EKG devices, so measuring the electromagnetic radiation of the heart, but I've also done it with simple wearables you can wear on your wrist that are, shining a light into people's skin and to measure the pulse and the pulse rate variability. And there we've been able to see it quite clearly. And that's quite
these
powerful.
are the same wearables that we give to the participants of the tip, right? Of
exactly.
The incubator. Oh, okay,
They're
cool.
exactly the same wearables. In this case, is the Garmin wearables that can measure these data. There we've seen quite clearly that the first part of someone's sleep, there's more stress, more activation basically in their sleep, and more lighter sleep when they have been working or on social media or the news, than versus if they've, for example, read a book, a fictional book as we covered, or they've, done something to just deeply relax. So it's affecting the quality of your sleep, even if you find it easy to fall asleep. So it's not to say you can't work during the evening or use social media. It's just really trying to, have the discipline to put that in and finish that at least half an hour before you want to sleep, so that your body and, including your brain, of course, is having this chance to wind down rather than wind up.
So that was sleep. Are there other ways to improve or reduce our stress levels throughout the day?
Good question. Yeah, and of course, there's a lot of other things you can do around sleep, and we'll go into depth on that in the Talent Incubator Module 2. In terms of daytime recovery, which interestingly enough also will impact sleep. So it's kind of like this nice relationship between more recovery during the day and better recovery during the night. But I mean, we all need at least an hour of recovery during our work day. And this could be 5 minutes here, 5 minutes there. It could be a longer, of course, lunch break of half an hour. But we all need this time for our bodies to recover. And that's not just important for our health. It's actually critical for our brain's ability to perform, I should say, because you have like a very limited mental capacity. And so if you think about your executive brain functions, so the ones you need to use to solve problems, make decisions, to plan ahead, to communicate to others, to prioritize. These functions are very energy hungry, and they can be, depleted within anything from 20 minutes to an hour, max hour and a half. But it depends on what you're doing, how demanding is the work you're doing. So it's really useful to look throughout your day and see where could you literally strategically have time to recover, even if it's just as little as 2 to 5 minutes. And I've seen, like with some of your colleagues, like some of the participants from last year's Talent Incubator, they found even just practicing a super simple breathing exercise for actually less than a minute really impacted their physiology. So they not only felt the difference, they also saw it in the wearable device that they were using, that, bringing this time in to, for example, the breathing exercise, reduce their stress level, not just during the breathing exercise, but actually for some minutes. And it can even be up to an hour afterwards, because you're just helping to shift your body out of this fight and flight response into this kind of, rest and digest, or the relaxation response. So what can you do to recover? It could be the breathing exercises. We cover all sorts of different ones in the Talent Incubator. It could be simply lying down and closing your eyes. It could be meditation. Again, it could be reading a book, like we talked about before sleep. It could be social, so time with other people, talking about things other than work. So just having that time to, to bond, to catch up. Sometimes it's also important to think about active recharge. So getting out, taking a walk, or even if you can't get out of the hospital, taking the stairs instead of the elevator or lift. So you're just getting some movement, which again can help you to have a better impact on stress later. In fact, there was recently a study that came out that showed 15 minutes of walking every 2 hours. So during the day, people might only do this 2, maximum 3 times during work, but 15 minutes of walking every 2 hours reduced stress by nearly 15%. But at the same time, it increased concentration by 27% and their productivity by 33%.
Well, that's nice. I'm actually practicing the walk and talk thing with my PhD students. Instead of just having a meeting, we walk and talk just to be a little bit more active. But I know we're going to cover this into depth during the talent incubator. But I'm just wondering, because many of these activities can be difficult to combine for the daytime recovery.
Yeah.
It might be difficult to combine in a clinical.
Yes.
In a clinical setup. But there might be something like, let's say, the breathing exercises. Those can be easy to adapt to do in between patients.
Yes.
Or in between surgeries. I mean, that doesn't necessarily have to take a lot of time. Can you give us a little bit of a tip on how to do that?
Indeed. Yeah. One of the great examples we actually had from a previous participant of the talent incubator was how they use the psychological sigh technique, which is, it's become very popular these days because of Andrew Huberman, but it's linked to, thousands of years of practice in different parts of the world. But that's where you're literally inhaling, ideally through your nose, because it's more relaxing to breathe through your nose than your mouth, but you inhale fully. And then it's like once you've fully inhaled, you take a second sip of air, like another small inhale. And then you exhale. You exhale via your nose or mouth longer than the inhalation. And to start with, I mean, it's not like you even need to count this, but it's just taking a more sort of forceful inhale, a second inhale on top, and then a nice long, slow exhale. That is a technique that you only need to do a few times, a few iterations before you feel the impact. And this participant even shared how they had actually done it during a surgery that was not going very well. He could feel the panic rising, did that technique. I can't remember how many iterations he did, but it was not many because it was actually in a surgery. And that just helped to, lower his stress levels and build a sort of clearer, faster way of thinking so he could be more resourceful and complete the surgery successfully.
I also do some breathing exercises right before I'm doing presentations. I'm giving lectures all around the world with the EAU. It's unavoidable to get a little nervous before you're performing. And what I do is that I do these breathing exercises right before, and then I really feel that my performance is much better. So it does work, at least for me it does. It really does.
It's a great example. This is something that a lot of people can benefit from, like, before public speaking, before doing an operation, even before like screening a patient. These kind of times where we really want to be present. And if you be at our best, it can even be between work and coming home to your kids, your partner. They're just, breathing is such a great way to shift our level of activation, but also our mental clarity. So, give yourself as little as a minute to 2 minutes and you feel a difference.
There are many other things that we can do to avoid stress, right? But we have only a few minutes left. Would you like to have a final comment on those?
Yeah, for sure. And they're big topics in themselves. But I mean, exercise, staying fit is a great way to manage stress, because the fitter we are, the more resilient we are. So, really trying to get enough exercise, both, of course, cardiovascular exercise, high intensity, things like hill sprints, mixed with, your typical zone 2, which could be through a gentle jog, a bike ride, or even simply walking, and then mixing that with, of course, your strength training. But getting enough exercise is really important for maintaining muscle mass, fitness, and stability. And then, of course, we have nutrition, right? So getting the key principles in place for feeding your body and brain so that you can be at your best. And that is a whole world in itself. But that's where we really look at having the time for people to reflect on what are the key principles of nutrition, and of course, exercise, daytime recovery, and sleep, and how can they build that into a realistic pattern for themselves day to day, week to week.
Thank you, Jason. I mean, if you want to know more about all these topics, please apply to the Talent Incubator Module 2 that's going to be in April in Valencia this year. Check it out on the website, euroweb.org/incubator. That was it for this time, Jason. Nice talking to you again.
Thanks,
and
Juan.
I can't wait to speak to you again in the next podcast.
Me too. Thanks very much.
Have a great day. Bye.
Thank you for this insightful episode. We are sure our listeners enjoyed it. To keep up with the latest EAU podcasts and stay informed on neurological advancements, be sure to subscribe to our EAU podcast channel on your favorite podcast app. Until next time, keep learning and stay inspired.